Hi everyone, welcome back to my channel. So in today's video I'm going to show you how to process a urine sample. So here I have a urine sample from a dog. As you can see, it is quite like brown in color, so I thought it will be interesting to show you the microscopy as well in the end of this video. So now I am going to start with centrifugation. So I'm going to transfer this urine to this bullet tube to separate the supernatant and the sediment. Okay, and with the remaining of the urine sample I am going to check the biochemical parameters. So I am using the company called Urine 14G reagent strips. Always close the lid. It should be kept in the airtight container. Okay, yeah. Either you can dip this strip in urine container, or you can make the urine flow through the strip. As the urine sample is very less, we are going to use the second method. So dab it on a clean tissue paper, and we have this urine analysis equipment. Okay, so I'm going to place the urine strip here and the process will start. Meanwhile, we have few drops of urine. So I am going to check the specific gravity of urine. I use portable refractometer. Always before using the refractometer, make sure you clean it and then add a drop of water and check the specific gravity. In that way you can actually calibrate. Okay, so after calibration with tap water, you can add 2 drops. Okay, 2 drops of urine. Make sure that there are no bubbles in it, and we can check the specific gravity. Specific gravity here is 1.016, I think. Let me show you. Okay. We can keep the refractometer aside and our results are ready. It is always important to check the specific gravity in the refractometer. With strip method is 1.030, but in refractometer the specific gravity was 1.016, and you should only rely the results that you get from the refractometer and not from the urine strip. Okay, so now we have this sample. You can follow me. Let's centrifuge the sample for 2 minutes. Yeah, so I'm using a mini tabletop centrifuge. Okay, there is a weight in the opposite side. I'm going to centrifuge it for 2 minutes. So the centrifugation is done and we have sediment. So with this sediment I'm going to do two things. One, I'm going to do a cytology and stain it, and with the same sediment I am also going to do a direct microscopy where we can actually identify cellular components, crystals, casts, etc. I am going to pour the supernatant. Okay. So for direct microscopy I am going to take plain slides, and for cytology I am taking frosted slide, and this is a spreader slide. I am using micropipette and tips. Okay. Zoom out. So with the spreader slide, I am going to make a quick smear. Just made, and I am going to put a cover slip on it. Hi. So let's examine it under microscope. First, you should always start with low magnification such as 4x and 10x. Once you select the field of interest, then you can advance it to 40x. So this is how the urine microscopy looks under 10x magnification. I am going to change it to 40x now. Yes, so in the background you can appreciate some bacilli bacteria and some cellular debris. There are few epithelial cells, many RBCs. Here you can see many WBCs and lots of bacilli in the background. So now we are going to stain this using Diffquick. First is fixative solution, methanol. And you have the solution number 2. Immerse the slide, and we can leave it in this stain solution for like 20 to 30 seconds. Always dab it on a clean tissue paper to remove the excess stain, and always close the containers. This is the last stain. Okay. Now we are going to wash this slide. Slide is ready, and now I am going to examine it under microscope. This is how it looks in 4x magnification. You can see plenty of degenerate neutrophils and bacilli, bacteria in the background. Always choose a field where the cells are more. Now let's see how it looks in 40x magnification. Okay, so here you can see the real pathology of what's going on in this patient. There are plenty of bacilli and lots of degenerate neutrophils. You can also see some vacuoles within neutrophils. So all these findings are suggestive of cystitis, bacterial cystitis maybe. We didn't see any cast or crystals in this urine. So when you find this many number of bacteria and inflammatory cells, it is suggested to proceed to urine bacterial culture and sensitivity. So friends, how was the video? Please let me know what you think in the comments. I hope this video was informative, and if you want more such videos, please subscribe to my channel. I'll see you in the next video. Bye.